This is a WHO Africa media briefing on the back of the summit we're having here in Ghana. We will present the latest finding from the State of Health Workforce in Africa 2026 report, the actions taken and issues raised to strengthen our workforce capacity in order to deliver proper healthcare to our people. This meeting is a hybrid one. We have online reporters. We also have you here. We will be taking questions from you, colleagues from the online. This is also available in English, French, and Portuguese. Please select your preferred language via the global icon at the bottom right of the screen. Joining us here in Accra, our Honorable Daminta Ando, Minister of Health Ghana, and Dr. Mohammed Janad, WHO Regional Director for Africa. We also have Dr. Fiona Branca, WHO representative in Ghana, and Dr. Adelaide Onyango, Director Health System and Services, WHO Africa. Joining us online from Brazzaville is Dr. Mary Rosalind Belizeri, Regional Emergency Director, WHO Africa, and Dr. Anne Strand, WHO representative in Cabo Verde. They will be available to respond to your questions. However, we also have the Honorable Deputy Minister for Health, Ghana, Dr. Grace Ayensu Dankwa here. And I invite Dr. Janabi to give us an update on the State of Health Workforce Report in Africa 2026.
Thank you, Moderator. Honorable Minister, ladies and gentlemen, Africa Health Workforce is at a turning point. We are making really progress, but we are really not yet achieving transformation. Today, WHO and member states launched the State of the Health Workforce in Africa 2026 report at a critical moment. The decisions we make now will determine whether our progress translates into really access to care for our people. Here is the paradox. Africa is training more health workers than ever before, yet nearly 1 million trained professions are unemployed, while millions still lack essential services. Over the past decade, the workforce has more than tripled from 1.6 million in 2013 to 5.7 million in 2024. Training institutions are now exceeded 4,000, producing over 360 graduates. And each year, has reached almost per 10,000 population, slightly above the pre-COVID levels. This is progress, but it's not enough. Africa has only 46% of the workforce it needs. By 2030, the projected shortage, if you round up, it will be about 6 million, a modest improvement, but fragile. At the same time, up to 27% of the trained workers in some countries are unemployed, while 1 in 10 have already migrated, and nearly half are considering leaving. And even where workers are present, quality gaps persist. Correct diagnosis in only 62% of the cases, and appropriate treatment is just 40%. So the challenge is no longer just numbers. It's about jobs, distribution, quality, and retention. So we must move from fragmented approach to a fully integrated strategy to plan, to train, and to retain. The Africa Health Workforce Agenda 2026-2035 sets a clear goal: 3 million additional health workers educated, employed, and retained over the next decade. This will require a modest but decisive shift, just $4 to $6 more per capita in workforce investment, with major returns of health, resilience, and economic growth. This forum, which you've just conducted now, must mark the shift from commitment to implementation. The question is no longer whether Africa can train health workers. The real question is, will we create the jobs, the systems, and the conditions to keep them and ensure that every African has access to a quality care? That's the question. I thank you.
Thank you very much, Dr. Janabi. I will now go to the Honorable Minister for Health, Ghana, Honorable Kobnam Intakando, to share with us Ghana's effort to strengthen workforce capacity and to support health delivery.
Thank you very much, Prof. Janabi, Madam Fiona, my own Deputy Minister for Health, ladies and gentlemen. You all agree with me that health workforce is a prerequisite for quality healthcare delivery across the globe. For us in Ghana, we have a very interesting scenario, and Professor Janabi has indicated some of the situations we are facing as a country. I was appointed somewhere last year in February. And so the total workforce we have in the health sector stands around 102,000 people. That notwithstanding, we have more than 100,000 of these health professionals who have been trained but are unemployed. And so it is very important for us to understand the challenges, to have a conversation around the challenges, identify them, and then work towards the solution. That is what is important. If after all these conversations, after all these conferences, and the challenges persist without solutions, it means we have not done enough. Let me begin from the training of the health professionals we have in this country. At the moment, we have assessed not less than 40 of our health institutions that we are from the diploma awarding institutions to degree awarding institutions. I dare say that about 15 of them are going to start this year. That said, we realized that there were gaps in the specialties, and therefore there was the need to fill those gaps. Well, we roll out Mahama Cares, which is dedicated towards the treatment of non-communicable diseases. And before you can effectively treat non-communicable diseases, you need certain specialties. And that's where we have those gaps. And so we have started in some institutions in the country, for example, Tamale Teaching Hospital, Kolebu, and then Komfo-Anokye, where we are, enrolling people to pursue some courses hitherto were not being pursued in the country. Oncology, critical nursing, nephrology. So the aim, number one, is to be able to fill the gaps and also to meet the global markets. As Professor Janabi stated in his remarks at the plenary, nobody is against the movement of health workers from one country to the other. But it is important to maintain the optimal workforce in your country. And therefore, there is a clear strategy where government has taken control over the narrative of the movement of health professionals from Ghana. So there is an interministerial committee that is seeking to manage the Ghana Labor Exchange Program. So the movement of health professionals from Ghana is being managed by the state. We've had the opportunity to sign some agreements or MOUs with other countries, and we think that that can also afford us the opportunity to recruit more health workers. Quite apart from that, government has taken it as a deliberate decision to absorb some of the people or some of the backlogs every year. Last year, we inherited a situation where about 13,500 of these health professionals had been recruited and deployed without financial provisions for them. There were a lot of, agitations here and there, but I dare say that we have been able to find a lasting solution to it, and we've even started paying them their arrears. This year, as stated in the opening remarks or the keynote address of Her Excellency, the Vice President of the Republic of Ghana at the plenary, government is targeting recruiting not less than 16,000 of these health professionals. As I speak to you now, we have financial clearance of about 8,000, to recruit 8,000 health professionals this year, and the processes are ongoing. And so it is important for all of us to have a plan we are working towards and make sure that we try to clear the backlog whilst we are training more. Government has also taken it as a policy to upgrade tutors in these health training institutions. So every year, government is sponsoring a number of these tutors to pursue their PhDs in order for them to give quality trainings to these health professionals. So these are the challenges and these are the solutions we have attempted. We cannot wait to have a perfect system, but I believe that gradually we are getting there. Thank you for the opportunity.
Thank you very much, Honorable Minister for Health, Honorable Kwabena Akando. This is the second African Health Workforce Investment Forum, a press briefing after the opening ceremony. This particular press conference has generated a lot of interest, both online and I can see from your faces. So we would open the floor for questions. We'll take some questions. We'll go online to take some questions. We will have questions from the room and then go to journalists online. They will submit their questions through the Q&A box on your gadgets. To begin with, we will start with some few questions that I have already received. And this goes to Professor Janabi. Prof, How can countries realistically increase investment in the health workforce given current budget constraints? So this is the first shot from the online team. How things from you here? Please, you identify yourself, your media house, and then you ask your question.
Right, my name is Obet King Gaglu. I work with AIB Network, GH1 TV, and Star FM. The problem of unemployment when it comes to the health worker, I think that it's already an identified problem. So it is solutions we want. For us journalists, when we out and we cover stories of these health workers who have been trained and yet do not have employment, we want to understand from government perspective, is there a broader plan? Okay? By 2027, the backlog of nurses, for instance, be limited because we see government's efforts in terms of recruiting these unemployment, but the hope that at a period in time, all these backlog will be cleared is not so certain. So the question is there a broader plan to see this backlog cleared?
Thank you. Thank you. I think it's clear. If you're online and you want to ask your question, you can also raise up your hand and then you'll be identified. Please, do we have any other question here? Yes, please.
Hello, everyone. Good afternoon. My name is Olutola Vivian Adeomi, representing Digital Health Africa. I would like to ask questions about workforce shift into tech. Largely, we'll be discussing unemployment and shortages coexisting, but we're also seeing, aside from healthcare workers migrating to other developed countries, we also see healthcare workers, even in Africa, also transitioning into tech roles. How is this shift being accounted for in workforce planning? And is there a risk of unintentionally deepening clinical workforce gaps? Thank you.
Thank you. So we'll take one from online. This goes to my boss, Honorable Minister for Health. With many health workers considering migration, what practical steps can improve retention in the short term? Yes, please. So we'll take the last one and then we'll come for responses. Then we'll open the floor again.
Okay. Hello, good afternoon. My name is Samira Labi. I work for the Ghana News Agency. So I want to ask Prof. Janabi, how urgent is the health workforce crisis in Ghana compared to other African countries? And then number two, what are the expected outcomes from this forum?
Thank you very much. So we'll take the responses. We'll start from Prof. Janabi. Yes, we can hear you.
The mic is okay, good. So I'll try to combine some of the questions, but the question was how, with a limited budget, we can move forward. One, I have to put it very clear. As WHO, we have 47 member states in Africa, and we don't go with our priorities. Each country has got its priority, but let's talk of this health. Can you hear it better now? So what WHO Afro is advising, be smarter with your limited funds. For example, I mean, governments can ring-fence 3 to 5% of health budgets for training. This is a very protected line. Shift from workshops on the job to digital learning. It's cheaper, it's scalable. We can advise the member states to pool their resources regionally, whether it's AU, whether it's through Africa CDC, whether it's from WHO, Afro, because coordination and avoiding duplication and fragmentation is a key to, and let's tap external funding smartly from Global Fund. You saw them, they were here, Gavi, partners tied to workforce, because all these partners, what they want to see is palpable results. They invest the money, they are our partners because they build systems. Training is very crucial. And one of the biggest pillars of WHO is on primary health care. So prioritize frontline skills, surveillance, IPC, intelligence response, train the trainer models, cascade quickly, and it's nationwide. And one of you touched here, leverage e-learning and simulation labs instead of travel and heavy training, and to try to integrate training into routine service delivery, not as separate events. The question of return. Let's try to link training to career progression and promotion pathways. Provide we call it non-financial incentives, recognition, certification, and leadership roles. I remember, if I might cite, because at the time I had not joined WHO, I was living outside for 19 years before I returned back to the continent. One of the incentives which the government took to retain people, we were not paying tax for anything we import from outside. So from vehicles to furnitures, they just let us go. They provided free housing for us. So my entire time there, I never paid rent. You get a, so those small things can attract. But the thing which I can say with my personal experience, as I said, I'm a public health scientist, I'm a cardiologist. My country didn't have a cath lab, and I'm an intervention cardiologist. We put small metals called stent, we put pacemakers. But we didn't have those equipments at home. So for me, personal, it was very difficult to return home because what will I do? But the government listened to the diaspora. In 2012, the country bought our first cath lab, which made me and others to decide to go back home. It's an expensive machine. It's $2 million by then. But that investment, I can tell you, it saved the country $6 to $10 million every year, because now we were not sending patients outside. And today they are doing wonders. I've been to Angola, it's the same thing. Kenya has invested a lot of kidney transplant. Uganda has invested a lot on cancer, and so on and so forth. So the bottom line, what I can say, in a context of tight budget, Africa must rethink, not reduce, but training. First, we protect a small and dedicated share of health budgets and use it smarter. And that means shifting from costly workshops to others, as I said. And the last thing, we return what we invest in by linking training to career progressions. So I think I've covered the tech. I touched about it, and I can tell you practically what we do with a small islands developing states. We call them seeds. We can do telemedicine there, and the neighboring countries like South Africa, who is a member state. So this is where we use technology. And they've got a smart, which WHO invested on it, smart classroom, we call. In that one hall, you can teach the entire Rwanda medical schools and our community health workers. We have provided our community health workers with mobile phones so they can either transmit images of which they've taken to district hospital or to regional hospital. But the bottom line here, dear media people, if you invest on primary health care, you can pick a high blood sugar before it turns to be diabetes. You can pick a high blood pressure, just elevated blood pressure before it turns to hypertension, then gives you all the complications which are there. So I really emphasize to invest on primary health care. And lastly, let me give you an example. Japan invested in universal health coverage in primary health care in 1926. By 1961, they were 100% covered the entire country. Now, you all know, if you want to live longer in this world, move to Japan. They've got the longest, not only longest, but a quality long lifespan of, I don't know, 88 and 91, male and female. So in technology and innovation, it's one of those four pillars which I discussed with other, the primary healthcare, innovation, local manufacturing, and sovereignty, which is part of the global health architecture and Accra Reset, Galvi 600, all those complement each other to achieve a healthier continent and healthcare which is resilient and can meet all the shocks which come along with this world today. Thank you.
Thank you. Honorable Minister, please.
Question as whether or not we have a broader plan to be able to absorb the backlog we have in the country. The answer is yes. We have a strategic plan to absorb not less than or between 15 to 25,000 a year for the next 3 years, working with the private sector. So, and we are bringing another concept which will also even keep those who are yet to be permanently employed engaged, and that is the volunteer or the volunteer system. The strategies or the preparation towards the implementation of the free primary health care, we are not able to fill the gaps within 1 year, which is not possible. Let us be very realistic, because these challenges have piled up for so many years. Because if you have come to meet an accumulation of health professionals who have been trained, and the numbers are somewhere 105,000 people, you cannot simply say that you're going to absorb all of them in a matter of 1 year or 2 years. And so, and we still have some gaps in the system. So what we are going to do is that we are going to engage some of these health workers on a volunteer basis. So yes, we have a strategy, 1, with the Ghana Labor Exchange Program, 2, with the private sector, 3, with a deliberate recruitment by government to mainstream these health workers, and then 4, with a volunteer system. So for now, that is a strategy we are putting in, but let's also be realistic here. They are also subject to the availability of funds. I sit in cabinet, and the issues are discussed there. You know what is in the envelope. And so at the end of the day, if you say you need salaries for 13,500 people you have been given, you say you want to recruit, you say, okay, go ahead and recruit. You say, okay, go ahead and recruit about 16,000. So within a matter of less than, say, 24 months, you are putting not less than 35,000 people on the payroll, you must also understand its financial implications on the national budget. And so it's one of the things we are having to deal with, to continuously engage the minister responsible for finance to always make a case for recruiting more of such people in the system. Now, the second question has to do with what practical steps we can take to improve retention. Yes, there are varied reasons why people leave this country or any country. The reasons have not been one. Currently, I have a problem of health professionals accepting postings to rural areas in this country. It does not mean that the vacancies do not exist. It does not mean that government is not ready and prepared to employ them. But what it means is that the professionals themselves do not want to go to other or some parts of this country. So it's a problem. Why? Because maybe the person doesn't want to live in the village. Some people will come and tell you, we have lived our life in the city all around, so we cannot live in the village. So it could be a reason why, if I'm not getting the employment in the city, I'm leaving the country. There's very little we can do about it, and let's be very realistic here. There are people who also express frustrations that, look, if I'm put to areas where I cannot even get the right equipment to work, job satisfaction is also a problem. So I don't even want to work in that environment at all. So I want to work in an environment where I can get job satisfaction. In that case, the solution is retooling of the health facilities, of which we are doing. You know, there are instances where, due to the general economic conditions, people may not want to work in their country. I give you an example of before 2024, our economy was not in the best of shapes. There are health professionals who have worked for a very long time and have invested their money in bonds. They ended up losing their money. So they didn't have the appetite of even staying in the country. It could be one of these reasons. There are reasons to the effect that people are completed, they are not getting job immediately, so they may want to leave the country. So there are varied reasons. There are reasons where people also think that they must be well remunerated. We must create better conditions of services for them. For example, some of these things I do not want to put out there because we have not finalized some of these conditions of service or incentives for people who are self-posting to the rural areas. But government is looking at that direction. So we are taking every necessary step to make sure, one, we create employment for the people or for the workforce, the health professionals who have been trained and have not been employed, and those that we have employed, that they are also willing and ready to leave the country. We are doing our best. So on that is what I can say for now.
Thank you very much, Minister. We have a question from Al Jazeera. But before that, we have Paul. You want to ask question online. Are you there?
Yes, I'm there. Thank you very much for this opportunity. So I have two questions. Dr. Janabi, health access discussions often focus on medicines, financing, and procurement systems. But from your perspective, actually WHO Africa's perspective and experience, how much of the real bottleneck is actually the health workforce itself, particularly in sustaining long-term care for chronic diseases across the continent? While for the Honorable Minister, thank you very much for your clarifications and explanation. I know that Ghana is often highlighted as one of the countries pushing forward on health financing and universal health coverage. But what lessons do you think Ghana learned about balancing investment in medicines and healthcare infrastructure with the need to retain and support enough health workers to actually deliver long-term care? Thank you very much.
Al Jazeera now. And this question is to Dr. Benzeri, who is in charge of emergency WHO. Could you confirm the latest numbers including total cases, deaths, and how many patients have been taken off the ship, as well as the situation of the CIU cases in South Africa. Also, what is WHO's current assessment of the public health risk? So we'll go to Dr. Onyango. How can governments better align training with actual health system needs and available jobs? This is to Dr. Onyango. To Dr. Branca, what roles should international partners play in supporting not just training, but also employment and retention? These questions, I'm sure they decide to just spread it across. So we'll start from Dr. Onyango.
Thank you for that question. It's clear about the aligning training with the needs. We are supporting working with countries to conduct health labor market analysis, and those are usually linked with an understanding of the public health and the burden of disease that the country actually experiences. So those analyses help each country to identify what the biggest challenges are so that we can understand what types of health workers are needed to address what burden of disease. It's a very systematic way of making a contextualized assessment of the need. And once that has been done, we bring together different sectors in a dialogue, national dialogues, where we put forward, this is our health challenge. And when we talk about the disease burdens, we are talking about also a health workforce that is a workforce, not just a health workforce, but a workforce for the entire population that is affected by health problems that are going to affect overall economic development. So that's why it's an interest. It's of interest also to the ministries of planning and the finance ministers to come together and understand why it is important to invest in health workforce so that we address the burden of disease that is likely to impact development. So one, we conduct those analyses to identify the public health problems. Two, we look at a projection of how many types of health workers are needed, the different cadres of health workers that are needed to address those problems, and then to put that on the table to show how investment is needed in terms of the numbers to be trained, the specialization, and over what projected period. So that's an approach that then helps us to know we need to train, for example, physiotherapists. We need to train more psychologists. We need to train more counselors, etc., because we know that the evolution of the public health problems indicate where the needs are, and that can be linked with training, a cost of training, because then if all sectors come together, then we understand why it's important for us to invest, not just as a health sector, but as an overall development ecosystem.
Thank you. So Dr. Gonaru, you answer pause.
Yeah, I think the question, if I got it correct, it was sustaining management of chronic diseases. But I would say as a public health NCDs specialist, is the principle is simple. Prevent, detect early, and manage continuously. So the focus is on the lifestyle. A healthy lifestyle I mean, a healthy diet, physical activities. I'm not sure. The media people here, you are supposed to walk 10,000 steps a day. Have you done it? A healthy diet. Let's just not eat because the time is there. Most of you have eaten breakfast today. Ask yourself, were you hungry or it was just 7 in the morning? No tobacco, limited alcohol. It's 1 drink per hour. So if you go out, if you're drinking beer, just 2 beers, drink the first one. 1 hour finishes, drink the other one. Then you can watch football after that. Regular screening is very crucial. Adherence to treatment. We're having a lot of problems now with antibiotics. You all know UTI, when I was a junior doctor, 2 days, I give antibiotic, 3 days, you are cured. Now it's difficult. How many of you have been given treatment for 7 days with antibiotics? How many of you have finished them? You didn't. Where did you throw them? If you throw them in the source of water, it means that you are giving me antibiotics, which I'm not supposed. We're having a big conference with your neighbors here in Nigeria in this month of June. So education, community support, and let's use the data and digital tools to monitor progress and to ensure access to affordable medicines. Our continent is still struggling. Almost 90% of the medicine, therapeutics, and diagnostic we are importing. That's why you hear our leaders are talking about local manufacturing. We are importing 99% of the vaccines. So most importantly, end of the day, empower to the patients to actively manage their condition. And if I have to finish, distinguish media and the public in general, the responsibility of health starts with you yourself. You have to take care of yourself, then the government facilitates other things. I thank you. I think I've covered most of.
Yes, I'm sure.
Question. Thank you.
So we'll go to Dr. Branca, and come to the Minister for Health. Yes.
Thank you very much. The question was the role that partners can play in supporting the health workforce around not just training, but recruitment and retention. As partners, work to support government priorities. And so we are pleased when priorities are articulated. We do have the health sector development plans that guide the way we support national priorities. So I think that first of all, it's alignment with the priorities. And we know that in the sector plans, the human resources for health are a critical component, and how we address the key priorities within resources for health, it cannot be government alone. There's a lot that partners can support. One is around the evidence generation that is needed to guide the investments. And we've talked about the health labor market analysis as one of the critical evidence mechanisms that are needed to guide the policies. And then also evidence around efficiency gains that can also guide where to invest are critical, and partners can play a role in generating that kind of evidence to support investments. We've also seen that, for instance, in the case of Ghana, a national investment plan, the health workforce, was developed. And so that there are clear objectives around alignment of training, creation of jobs, and retention modalities, opportunities that partners can play in making this investment plan a reality. The other aspect is the innovative financing mechanisms. Honorable Minister has talked about the plan to have a large workforce executed or implemented this year. That requires money. And the practical side is that not all governments can be able to finance all the workforce that they need. And so partners have a role to job creation based on quality and standards that are set by the government, as well as the diversification of financing sources, how we support the creation of the jobs, but also how we exchange of information on countries are diversifying sources of funding, not just for health workforce, but the sector in general. There are examples to learn here in Ghana. There's a lot of work around health taxes, how we can utilize taxes from certain commodities, again, to go back into the sector to promote the very diseases that we are trying to prevent around use of tobacco, alcohol. These taxes can help to go back into the sector to address needs around non-communicable disease control. So in summary, yes, indeed, as partners, we have several opportunities to contribute to the health workforce development in countries. Thank you.
Thank you. Honorable Minister for Health.
Yeah, thank you very much, Tony. If I heard rightly, somebody was asking me about how we could balance infrastructure and medicine, or health professionals and other health workforce. When there is a lot happening at the same time, you may not have enough to apply at a particular sector. So, for example, in the health sector in Ghana, we are pursuing free primary health care, we are pursuing Mahama care, we are pursuing the construction of regional hospitals because we have 16 regions at the moment, and we have only 10 regional hospitals. So we are pursuing it. We are pursuing district hospitals. We are pursuing Agenda 111. We are pursuing recruitment of health workforce. We are pursuing preparedness of no-birth syndrome, emergency preparedness. We are pursuing issues of ambulances, digitization of the health sector. You can't leave any of these behind. And so there's a lot on the plate. And so what we have decided to do is to also invite the private sector in, so that where the private sector can maybe take part, you allow the private sector to take part, so it will free that resource, that physical space, for government to also invest it somewhere. For example, we have started more than 100 health facilities across the length and breadth of this country, and we require more than 20 billion Ghana cedis to be able to finish. We cannot have that 20 billion Ghana cedis within a year or two. So what we are doing is that we are bringing the private sector in. Given the level of completion, you can come and continue and have an arrangement with government, and then the private sector can continue to run those facilities. Secondly, we have something we call the hospital equipment placement. We are developing a strategy, SPV, special purpose vehicle, where the private sector can engage government. They will put their equipment at these government health facilities. They will be paid according to usage. And then the government can use that funds maybe to go to recruitment or maybe to build more health infrastructure. So I think that we should bring the private sector in to also come and contribute to what they can to free that physical space, whilst partners are also doing their bit. But realistically, where even partners come in, they always have a limit. And they will always have, the programs will always have an expiration date. For example, the P4R, we have a program we call P4R. The P4R, about 2-3 years ago, absorbed about 250 physician assistants. Okay. Now, at the end of the program, it is up to government to absorb them because the program has ended. So we are compelled to absorb them into the mainstream this year. yes, it allowed us some space, but it has also placed us at this situation, whether we like it or not, to be able to absorb these people. And so I think that we welcome all assistance, and we think that we will apply our monies where it is needed most. Yeah.
Thank you very much, Honorable Minister. There was a question from Al Jazeera, but before we go online for Dr. Ann and Dr. Rosalind to answer these questions, let me add one. This one says, my name is Ellen Shikanda from the National Media Group in Kenya. My question is on the hantavirus. So it's the same question. Hantavirus outbreak reported in cruise ship. Are we anticipating the cases to spread on land since we have already reported one case in Switzerland? What can African government do to prevent should we find cases in Africa? What does this outbreak tell us about the One Health approach and the pandemic agreement that is now dragging? These questions will go to our online Dr. Rosalind and Dr. Ann. Please, these two questions are for you.
Thank you, and good afternoon, everyone. And thank you for this important question. As you know, we are dealing now with an outbreak linked to a cruise ship starting from Argentina, going to the...
Yes, we can't hear you. Please unmute.
I am on mute. Can you hear me now? Can you?
We can hear you now.
Okay. So I say thank you so much for this important question in that moment that WHO, together with all partners in member states, we are dealing with that outbreak starting in a cruise ship. This travel starting in Argentina more than 3 to 4 weeks ago. So WHO, we assess the situation, and actually based on all the evidence we have and the assessment that we conducted, so the risk is evaluated as a low at global level, as a medium in the ship, in the cruise ship, and also is a low and medium for Africa. So what was the situation? So far, we have 8 cases, linked to that outbreak. So we have 3 deaths, unfortunately, and we have 1 case in Switzerland, as the journalist mentioned. So what can member states do in terms of that? So WHO, we release, a brief for member states where we really recommend that member states reinforce surveillance, also laboratory system and clinical care. So for hantavirus, we don't have a precise treatment for now. It's really to take symptomatic care and also to give very good clinical care to the patient. So we don't have a specific drugs that can treat rotavirus and so forth. Other information also that we can share is that at the country level where we have the link with the outbreaks so far in South Africa, we are supporting the member state to conduct contact tracing. So far, we have 69 contact that are under close monitoring in case there is a symptom, so we can be quick. So this is also a recommendation to member states to be vigilant, to increase the vigilance, to increase the surveillance system, the clinical care, and also the IPC. So in Cape Verde, I will leave my colleague Anne, who is the WO in Cape Verde, to say what she's doing, supporting the member state in Cape Verde. But I can say that at regional level and global level, so what that outbreak tell us? That outbreak tell us that for more than ever, the world needs WHO. So it has been only through that focal point, IHR focal point, International Health Regulation focal point, that this outbreak has been detected. There is no really other organization that can put all the world together in that one. You know, something started in Argentina, coming to Africa, now it's in UA, linked to Europe, in Switzerland. We have more than 23 nationality in that ship. So that's really important to know that we need the global, arena of public health where we can have all the member states together. This network of a national focal point for international health regulation has been key in detecting that outbreak, and we are continue to manage that outbreak together with all the member states involved. So let me stop there and give the Anne so she can add more information regarding how we are supporting the member state of Cape Verde and to going forward with that outbreak. Thank you, Anne, over to you.
So, Dr. Roslin, I can't agree with you more. This WHO has, from the start, coordinated a very time-sensitive and multi-country response under the international health regulations, really ensuring patient care and then protect populations. And so, of all those interventions that we've done is giving guidance to the ship operator on how to manage the health of the passengers on board, medical evacuations and treatment. 3 patients flew out 2 hours ago here from Cabo Verde. They were medically stable. They were going to Netherlands for future care. So what now is going on is international contact tracing, as Dr. Roslin was saying. We have been taking samples of the clinical patients on board, and they're being analyzed right now. And I think I'm getting information by the end of the day at Institut Pasteur in Dakar. Of course, we've also doing risk assessment and information to all of those countries involved through the IHR channels. The boat that is still currently in the harbor of Cabo Verde in Praia will be leaving in 2 hours. On the boat right now, there's been a reinforcement. One medical doctor from WHO, who's also an epidemiology specialist, will be taking care of if there will be more cases on board, but also doing epidemiological investigations together with other international colleagues on board.
Maybe,
and Dr. Roslin, just add in this before we take the closing remark from Dr. Janabi. What can you tell us about the strain confirmed in South Africa and Switzerland? Is the variant more transmissible or a new variant? Plans
So far,
to evaluate the German woman whose body is still on the ship. So these are questions to Dr. Han and Dr. Roslin. Thank you.
Thank you again for the question. So far, we have the same virus confirmed. So in South Africa, it was the hantavirus and this, type. And it's also, we just received at the time I'm talking with you, the result from IPD in Pasteur Institute of Dakar. As I mentioned, the WHO, which is a collaborating center of WHO, and the sample collected from Cabo Verde were sent to Dakar yesterday. So today we already have the result, and they confirm the same, virus, the 3. So far, I think we can, with cautious say that the cases are linked to the same outbreak, because it's the same case, the same outbreak, the same virus also confirmed in Switzerland, in the patient evacuated in South Africa, and also in the patient that where the sample were collected also in Cabo Verde. So far, we can say with the lab result that the cases are linked to the same outbreaks. But however, we are still conducting more investigation. As you know, we are pending for more data, epidemiological data. So we've more with more to confirm totally, the outbreaks. But so far, all the cases have the same lab result. Over to you, Anne.
I also just got the news from Institute Pasteur that you had the positive for hantavirus as well. So this Andes type is the one which has shown before to be able to spread human to human more than other strains. So this was, however, we must say that the risk is very low still. Even on the boat, there are 147 people that was on that boat, and we now, as we said, had 8 people who have been showing signs. There needs to be, even with this Andes, a close contact between sharing cabin or being a couple or something really being close to be able to spread the disease from one or the other.
Thank you very much. We'll take the remarks from the closing remarks from Dr. Janabi. But before that, so you come here to wrap up. But there is one question from a Minister of Health in Africa who is asking whether is African directly involved in this. So please, as you are wrapping up, please touch on this. Thank you very much.
Thank you, moderator. So colleagues, we were in workforce, now we're in hunter. So colleagues, what you've heard, my colleagues, the hantavirus event is a reminder that even rare threats can test our systems, especially in a world of increasing mobility and human-animal interaction. So while the risk remains low, the lesson is very clear. Preparedness depends on people. So our strongest defense is not only on surveillance and on the laboratories, it is a trained, motivated, and retained health workforce. Without skilled frontline workers, even the best strategies cannot be implemented. So as we leave here, let us commit to 3 priorities. Plan better by protecting training investments, train smarter using scalable and practical approaches, and retain our talent through clear career pathways and supportive working environments. If we get this right, not responding to hantavirus, we are strengthening Africa health security for every threat ahead. Is Africa directly involved in this hantavirus incidences? Yes. Although this ship started from South America in Argentina, it's heading, as you heard, it's heading to West Africa in Cape Verde. The critical cases were treated in our member state, South Africa, in ICU. So the bottom line just tells you, multilateralism, the WHO are very pillars of health in this globe we live today. So we need to work together. No single country can achieve without being together as family. As usual, as our DG always says, there's no one who is safe, or there's no single country will be safe if one country is not safe. I thank you for your attention. Thank you.
Thank you very much, Honorable Minister, for here. Please, it's your time for a closing remarks. Yes, please.
I don't think I have anything useful to add. Just to use this opportunity to thank Professor Janabi and your representatives for choosing Ghana as the venue for this very important forum. And we'll continue to assure you that we in Ghana will continue to be the advocate of the health sovereignty, and will also, leave an example. They say that. Thank you very much.
Thank you very much, our panelists. Thank you, Dr. Janabi. Thanks, Dr. Nyeng. Thank you very much, Dr. Branca, and thank you, Honorable Minister of Health. To our Honorable Deputy Minister, we are grateful. Minister, thanks for making this happen. We'll continue to Friday. We'll be here till Friday. Thank you very much. Our online journalists, we are grateful to all of you, to everybody who made this possible. God bless us all. Thank you.